Lymphedema is a type of swelling that is caused by abnormal buildup of fluid in a limb or a part of the body. The veins and lymphatic vessels work to help pump the fluid out of these areas, but when the lymphatic system isn't working correctly, it can get backed up and cause lymphedema. Using a special type of bandage to apply pressure to the area can help get the fluid moving out and reduce your lymphedema. My name is Kelly and I'm a physical therapist and I specialize in oncology, lymphedema, and women's health. And in this video, I'm going to show my compression bandaging routine to help reduce lymphedema in the leg. On this channel, I show tips and tricks to help reduce your symptoms and your side effects so you can get back to focusing on what's most important in life. If this fits you, be sure to follow along by subscribing down below for weekly new videos. Compression is the main component of complete decongestive therapy to help reduce volume from lymphedema, but also from general swelling like venous insufficiency. If you have swelling in your leg, moving directly into a compression stocking may not be the most effective way to reduce your swelling. Compression stockings are meant to be a maintenance garment, therefore they are meant to help keep you at your size and not allow you to expand or grow any further. They are not going to do a great job of shrinking or reducing your swelling. So for most of you, going through 1 to 4 weeks of complete decongestive therapy with this bandaging is going to help reduce you or shrink your swelling, and then you can go back into your compression stockings at your new smaller size to help maintain. So for this compression bandaging routine, I'm going to keep it pretty basic and pretty simple, knowing that there are going to be a lot of individuals that need more compression with more foam, and some will get away with less. Make sure that you work with your certified lymphedema therapist to find what works best for you. So with my bandaging, what I'm going to use is first stockinette. So stockinette is used to go against the skin. So if you place lotion on your skin, which you should be doing, you want to use the stockinette over the top so you don't get lotion on all the bandages, but also keeps your skin really nice and clean and dry. The next thing I'm going to use is elastomol for the toes. These are going to be compression for the toes. Most of the time they're going to come in a 2-inch width size, and what we do is take it and re-roll it, folding it in half to create a 1-inch double layered roll. Some individuals will just need 1 roll, while some people may need 2 if you have a larger foot or more swollen toes. In this video, I'm going to be using a Rosedal soft foam for my padding. If you don't have as much swelling or you're a little more sensitive, you may get away with something lighter like Artiflex. And a lot of people may have used the gray foam for their compression because this is what a lot of CLTs are taught in their training. However, I do find that this gets to be a little bit too bulky for some people and makes it a little bit more complex for wrapping. So I'm going to go a little bit more moderate and use Rosedal soft. Now, if you are unsure of different types of foams or pads or what will work best for you, I have created a video on the different types of foams and paddings, and I'll place a link for that down below, or you can click up above here. Now, by your choice, if you want a little bit more compression over the top to keep the bandage in place, you can get something like tubular bandage or Tetragrip or Tuba Grip, and this will give a little bit of stretch and compression over the top. For bandages, you want to make sure you're using short stretch bandages, not ACE bandages, which are long stretch. Short stretch are something like Comprolan. They are going to give a nice stretch, but they're not going to cause as much of a tourniquet when you're resting. All of these products you can order online. I am placing links down below for each product where you can get them for high quality but low price. So pro tip, what you want to do before you start is get your tape ready prior. You can use something like masking tape, or what I use is a 3M transport tape. I think it does a really nice job of holding still. So what you want to do is go ahead and rip off a few inch pieces and put them on the side and have them ready for yourself. Okay, so the first thing you want to do is apply lotion to the full leg. Make sure you avoid lotions with a lot of perfumes or chemicals in it so you don't irritate your skin. Then, after your lotion, you're going to apply your stockinette. You want to make sure that you get the right size and that you cut it a little bit longer than you think, because when you stretch this out, it will shorten it. Okay. So now the stockinette's on, we're gonna go to the toes. For the toes, we're gonna use our elastomol. I have it rolled up, And what we want to start to do is we want to anchor it below the toes. You want to make sure when you're doing the toes that you don't get the little toe, because it does get irritated if you push down onto it. So I'm going to anchor it just above that and wrap around. And then we're going to go one toe at a time. So what I'm going to do is I'm going to start at the end of the large toe and wrap around 1 to 2 times. Depending on how swollen you are, you can add a little more. And we're going to overlap about halfway until we get to the base of the toe. And then when we get to all the way back to the end, we're going to go around to anchor again, and then we'll move on to the next toe. So coming up to the end, and then wrap around a couple times, making our way in. And I'm going to go ahead and continue and finish with the rest of the toes. So after you have your toe wraps, then we're gonna go to the top of the foot. For the top of the foot, you can use a couple things. You can create a gray piece of foam that is shaped for the top of your foot, or you can purchase a Swell spot, which is a pre-made fabricated dense piece of foam that you can place on the top of your foot that you don't have to shape yourself. You can also create one of these on your own, and I have created a video on how to create your own Swell spot, so I will place a link for that down below, as well as where you can purchase one of these. So for around the ankle bones, it can be a really stubborn area that swelling likes to sit. So you can cut out gray pieces of foam that will fit around those ankle bones, or you can also purchase these complex pieces or little kidney shaped pieces that will fit around the ankle bones. That does a really nice job of getting into those crevices so you can bandage over the top and shrink those stubborn areas. I will place a link down below where you can purchase these too. To keep it easy today, I'm just going to use my Rosedal Soft and wrap over the top. So what you want to do when you wrap, or what I like to do, is think about a snail. So you see the round on the back and then the flat part on the bottom. I try to make sure that is flat so that it's a lot easier for you to unroll. So starting at the base of the toe so you don't hit that bottom baby toe, I'm going to wrap around until you get to about where the top of the ankle is. And then what I like to do is come around the back and then come back down and get the heel. Now the heel doesn't swell a whole lot naturally, so you may not have to worry about covering the heel perfectly, but you do want to make sure that you're patting the rest of the area well. From there, I'm just going to roll it up, overlapping about halfway, all the way up. You don't have to pull really tight, you just want to pull enough so that it lays flat until you get right below the back of the knee crease. And then from there, I'm just going to tuck it in. If you have troubles with that, you can also tape that down. We're going to next use our short stretch. I'm going to use a 6 centimeter for the foot and ankle and an 8 centimeter for the lower leg. If you do have a more swollen leg right now, you may need a third wrap to help get the rest of the calf. So when you wrap this, you want to try to keep your ankle at a 90-degree angle. You don't want your toes pointing down a lot, because then you're going to have a lot of issues with the bandages falling in the back, but also pinching in the front. So keeping your ankle up. You're going to start right below the base of the toes. Again, watching that little toe. And as you pull around, you want to give it a good stretch. You don't need to pull as hard as you possibly can, that there's going to cause some wrinkles or tourniquet, but you do want to make it nice and snug, overlapping halfway. And then when I get to that top of that ankle, I'm actually going to come behind the ankle and then come around again underneath to overlap by the foot, and then around the ankle, and then down around the foot again. So you're making almost like a figure 8 up and down until you get all the way covered. And then from there, you can start to roll up the leg, or if your foot is the most stubborn, feel free to add a couple more layers around there, just making sure that you don't make a tourniquet in front of the ankle. So I'm gonna roll up the rest of the way. And then we'll tape it down. So for the second one, what we're gonna do is start a little bit at the foot, because we are looking for a gradient pressure, meaning that there's more compression low, working towards less compression high. So I'm gonna take my 8 centimeter bandage and start right around the foot. and add a little bit more compression to the foot. And then I will start to work my way up the leg, overlapping about 50%, but making sure I'm giving a nice pull as I go around. So there's the compression for the lower leg. Now, if you have something like venous insufficiency or just swelling in the ankle and foot, you can stop right here below the knee. If you do have lymphedema and you have swelling up higher, we're gonna keep moving on. Okay, so turning so you can see me, we're gonna move up towards the thigh. What I like to do is take a couple layers of this cotton padding or Artiflex and place that behind the knee for more comfort. This area tends to get tourniqueted after the bandage is rolled down or cut off here, and so this will help avoid any irritation. What we're gonna do is place the cotton behind the knee and use our Rosedal to roll over the top. When I'm adding the Rosedal Soft, I do keep a little bit of bend in the knee for comfort, but I try not to do too many layers of this padding right behind the knee to avoid bulk. So we're going to keep it still overlapped about halfway with enough pull so that it lays flat, but then move on past the knee. Overlap here. Okay, so we have our Rosedal up. I could have made this a little bit higher. If you have a lot of swelling up high, you want to make sure that you're getting this padding a little bit higher than I did. But what we're going to do now is to take our Comperland rolls, and we're going to start right about below where we ended prior, so there's not any gaps in between. And we're going to do the same thing of overlapping halfway, giving you a nice compression. When you get to the knee, because I don't want a lot of layering or rolling of the bandages here, I like to take the end of the bandage, so right on the crease, and put it right where my knee crease is or where my bend is, and come around, and then I like to come just up above that crease, and then I'll finish with one more right in the middle. So therefore there's only about one layer truly on that crease, but everything is still well supported around the knee. And then I'll continue rolling up the rest of the way. Okay, and then I'm gonna do one more roll. These are both 10 centimeter, and I'm gonna do the same thing, but I'm gonna start a little bit higher. And so again, there's not a lot of layering here, but just maybe one. And then we're gonna roll up the rest of the way with good compression. So this is a pretty good compression wrap. However, if you want another layering, what you can do is take a larger one, this is a 12 centimeter, and start again down by the foot and ankle and do one large wrap all the way up. So it'll look like this. And then what we want to do is tape this down really well. So I'm going to use multiple pieces of tape. And make sure you're getting the ends down. And there's your wrap. So like I said before, what you can do is take a tubular bandage, such as a tuber grip or a tetra grip. This is a little too small for the leg, but it does have some stretch to it. And when you place that over the top, similar to how the stockinette sits is all the way up, it will help hold the bandages in place while giving a little bit extra compression, and that will help avoid them from falling down too quickly. So there's your compression bandage routine for lymphedema of your lower extremity or leg. When you have your compression bandages on, it is a really good time to get your exercise or activity in. And your muscles are pumping with your exercise. It'll help get the fluid move out a little bit quicker to speed up the reduction of swelling. You want to make sure when you're using your bandages routinely that you wash them frequently so they get their stretch back, but also for hygiene. You can hand wash them or put them in a machine in a lingerie bag so they don't get tangled and everything, and then line drying them is best. You can wear your bandages for up to a couple days. However, if you have any skin issues, you want to make sure you're taking them off each day and checking your skin. You can leave them on for 23 hours a day, taking them off to bathe or shower, and then putting them back on. If you have any severe pain or tingling or numbness in your foot, you want to make sure that you take your bandages off and likely loosen up your bandages next time you try. Continue to work with your certified lymphedema therapist to find what works best for you with different types of foams and paddings and layering. If you found this video helpful, please let me know by pressing the like button, and I'll see you all at the next video. Thanks everyone.